If teeth grinding becomes problematic, there's a few things you can try. First, try reducing your stress levels. We could all use less stress in our lives. Ask your doctor about cognitive behavioral therapy to reduce stress before bed. Good sleep hygiene and sticking to a calming wind-down routine will also help. Botox injections have proven effective during extreme sleep bruxism cases. All medications have pros and cons and should only be taken after talking to your doctor. Nighttime mouthpieces will help prevent further damage. Talk with your dentist about getting one molded for your mouth. You can also get them over the counter. They won't stop you from grinding your teeth though. If you think you have sleep bruxism, don't wait until it's too late. Your doctor or dentist will know right away.